Hello, everyone, and thank you so much for joining us for the Fall in Love with Your Mind panelists. My name is Maya Connor, and I will be your host for tonight. Our goal tonight is simple. We just want to start a conversation, a healthy conversation regarding mental health, and it is my prayer that after this panel tonight, that you continue these conversations in your homes, with your friends, and in your community. Before we get started, I just want to say that today's discussion is for educational purposes only. If you or someone you know is in an immediate crisis or is having thoughts of harming themselves or others, please call or text 988, or if it's an emergency, call 911. But tonight isn't about a crisis at all. It's about awareness and education, and just making sure our community feels supported and informed in regards to mental health. Mental health affects us all spiritually, physically, and emotionally. So together we've gathered professionals to start this conversation and to just help you feel more informed. Joining us tonight is Ms. Lauren Coleman, Ms. Sheena Trammell, Ms. Brittany Preston, and Ms. Ayana Hollowell. And now I'm going to let them introduce themselves, starting with Ms. Ayana.
Hello, I am Ayana Hollowell. My credentials are PharmD and Major.
Hello, my name is Brittany Preston. I am a certified teacher from PK through 6, and I've been in the classroom for 5 years.
Hi, I am Sheena Trammell. I am a QMHP and also a mental health first aider.
Hello, I'm Lauren Coleman. I am a licensed resident in counseling, and I have been in the practice since 2014.
Welcome, ladies, and thank you for joining me tonight and being willing to share your knowledge. All right, we're going to start with Ms. Brittany on tonight. So the first question we have is, as a seasoned educator, as you have stated, what have you observed about the way that students talk to themselves?
So how I see students talk to themselves can be in many different ways, such as you have positive talk, you also have negative talk. But as an educated teacher, you kind of have to know the environment, what you're doing, the student, and you have to encourage them as best as you can.
I work with Brittany. I've seen her being encouraging to her students. And how does the negative self-talk impact their academic performance and their self-esteem?
So I believe that a lot of people don't really understand that the tongue has power. And so when you're in the classroom and you're seeing your students constantly say, I don't get it, obviously they're not going to get it. And so I emphasize in my classroom that you can do all things, heavy on the all. But yes, I try to make sure that they can do all things, and if I can push them and I can encourage them, then we can see the progress.
So with encouraging them, I guess, do you see a difference in their self-esteem and their improvement in their work?
Oh, absolutely.
That's good. So with that, how can parents assist their children at home with helping you? Because it takes a village, it's not just a teacher. How can they assist you at home with helping them be more confident in who they are and in their ability to do their work?
So the first thing that parents can do is, number one, take care of yourself. You have got to get your mental together before you can teach your child, because otherwise it's the blind leading the blind. So you have got to make sure and be aware of what you're going through, and just self-awareness. Like if you're going through it, be aware, sit in that moment, sit in that season, take the time to get healed before you can go and teach your child how to have positive thoughts.
I love that. And what kind of resources does the school have, if you know, to help parents who may have a child who's experiencing some mental health troubles?
Well, each school has a school counselor. They are available. The students can go and they can talk. There's also resource officers.
All right. And my last question for you is, how do you feel about parents reaching out to you for help with their child?
I believe that it builds the community because they don't see what we see and we don't see what they see. So it helps to build the connection because they may be experiencing one thing at home but experiencing another thing at the school. So it's a good thing. That way we can come together to help the child.
I love it. I love it. Did you have some, Ms. Lauren?
Always. So I'm curious to know, what does it look like having the school resource officers, but our community has a very big stigma on law enforcement. So if the parents don't really respect law enforcement, can we expect the child to have that same respect?
Well, children are like sponges. So if they see the parents not respecting, they're not going to do it. But that's when we step in as educators and we show them that, hey, it's not all negative. It's not all bad. You know, they are here to help you. And I know for DPS, they do have, where resource officers, they do come in and they take the time to talk to students.
One more question. What about the fact that most of our school counselors, they're more focused on testing than they are on the child's actual mental health?
That's a good question. And I agree, there is a big focus on pushing tests and test scores. But I can say there are counselors who come into the classroom and they actually teach the students, and they also give them testing and strategies and how to control their emotions. So, you know, yes, there is a push, but there's also, they're coming into classrooms, they're talking to the students, they're showing the students, they're going over scenarios. But there's a balance.
I agree. With working with a school counselor, shout out to Ms. Casey, I hope she don't mind me saying her name. She cares a whole lot, and there is a role that she has to play as far as the education goes, but I did see her take the time. If parents reached out, she went and got the child. You know, she would meet with the parent and the child. If she needed to, stay after school, refer them out to other resources that they needed. So school counselors are pulled in a bunch of different directions, but they still hold that mental health piece to be a support in the school. Thank you, Ms. Brittany.
Thank you.
All right, Ms. Ayana. As a pharmacist, you understand both the science behind psychiatric medication and the stigma that can surround it, especially in our community and in the church, because I have heard so many negative comments regarding psychiatric medication from the Black community. So I would like to know, what advice would you give someone who feels hesitant about starting psychiatric medication?
So I would say with mental health as a whole, there is a huge stigma surrounding not only mental health, but also getting help for those who struggle or deal with mental health. So a lot of the stigma that surrounds mental health as a term, or the different diagnoses, anxiety, depression, we stick ADHD under there, schizophrenia, bipolar, also follow the medications as well. So for a person that's a little bit on the hesitant side when it comes to the medications, I would first address their hesitancy. What's kind of drawing them back from wanting to take mental health medications. So we have a lot of people struggle with, I don't want to feel like I'm crazy, or I don't want others to judge me for taking medications or for having mental health as a whole. And then when it comes to religion, a lot of people struggle with the fact of, am I praying enough? Am I fasting enough? Am I seeking God enough? Is that the reason why I have a struggle with mental health? And so first I would tackle that. No, there's nothing wrong with you for having an issue or a condition, struggling with mental health. You may struggle in your mind. I might struggle with my blood pressure. Another person might struggle with diabetes. we all have struggles. So just as much as blood pressure or diabetes or any of these chronic health conditions are normalized or dealt with, so is mental health. And there are options and therapies available, medications available for those who need it. So just addressing, what's drawing them back from taking the mental health medications.
Okay. And I know that you are a doctor, but you are not their PCP. So can they ask you those questions and can you give them an answer?
So we focus more on side effects. We focus more on, what are available options. But we are also always going to kind of encourage you to talk to your PCP, or for those who don't know, your primary care provider, to encourage you to kind of explore those options. They have a more holistic picture of other conditions that you may have, other medications that you may be on, how those interact with each other. And so, yes, we can talk about side effects, we can talk about all of the things, but end result, go back to your PCP so they can kind of steer you in a more clear direction.
Okay. I know for me, when I am at the pharmacy, even if I have questions, most of the time the pharmacist is back there busy. They look like they don't want to be bothered. Most of the time they don't look like me, so I'm already intimidated. So what advice, or what would you say to someone who was just like, she don't want to talk to me? What am I ask her for? What would you say?
I would say just start the conversation. Working in healthcare in general is a little bit on the hectic side. There is a lot that goes into working in the pharmacy, working in healthcare in general. But just start the conversation. Most healthcare providers are more willing to talk to you than you think. But just start the conversation. If you are taking a medication and you don't like the side effect of it, it's okay to talk about it, see what else is out there, and just explore other options. But just be open to asking those first questions and getting the help that you need.
Okay, thank you. You guys have any questions for Ms. Ayana before we move forward?
No questions, but as a comment, the pharmacy is starting to look more like our color these days. Just throw that out there. Oh, sorry. So, like what I was saying was that the pharmacy is starting to look more of our color these days. We're in there. We're in there, and sometimes it's a lot easier to talk to someone who looks a little bit more relatable to you, versus. All right.
Amen. The pharmacy is starting to look like us. The doctor's office is starting to look like us. The psychiatrists are starting to look like us. The counselors are looking like us, and we love it. So keep going, guys. All right, Ms. Sheena.
Yes, ma'am.
As a minister and someone who has personally navigated mental health struggles, what would you say to someone who is trying to understand where God is while they are struggling in their mind?
The first thing that I would tell them is to seek God for guidance. The second thing I would tell them is to be patient with themselves, because mental health is a process. You have to learn how to train your mind, because if you have been around negative and different stuff all your life, you have to learn to train your mind and take care of your mind. You can't go by, well, people tell you, well, no, you shouldn't do this, no, you shouldn't that. No, it's your mind. And if you feel like something is wrong, then you go and find help. Don't just sit there and just settle for, hey, something is wrong with me, but I'm not going to get any help. No, seek help, get help. If you can't go to a therapist or anything, get with a group of people that can encourage you, that can give you something that can make you change your mind to where you can get the help that you need.
Okay. Very, very, very good answer.
And another thing is, don't be afraid, like Sister Anna has said, don't be afraid to get medicine. Medicine is the key. And with me personally, take the medicine until you get to where you are in God, to where you don't need the medicine anymore. You know, you have to get that strength. You have to get that, be strong enough in your mind. Because as me, I said that, God, I will take this medicine, but I don't want to take it for life. So I want to take it to help me get to where I need to be. And then when I get there, God, you do the rest. I trust you to do the rest.
That's really good. That's the next question I was going to ask you is, what can we do to strengthen that relationship? You know, what are we saying to God? What does that look like? God, I'm struggling in my mind. I can't even pray right now. I can't even think straight. My mind is going 1,000 seconds per minute. What do I do? What do I say? Who do I turn to? What scripture do I read? You know, like, you know, what do I do? But I think you answered that pretty well.
Oh, y'all waiting for my question? Well, so based off of what you said, so would you recommend that same advice to all persons who battle with mental health? Like, would you tell the person who goes through manic episodes, it's okay, stop taking your medicine once you feel like you're in your place in God? Or would you encourage that person, no, you actually need to continue your medication, understanding that I don't want to be on this for life, but this is what is going to help me for not going out here and doing something that's very extreme? Would you tell that to the same person?
I would not tell that to the same person because, like I said, everybody's different. Everybody have their own mindset. But if you know that you need it to take it longer, then take it. You know, I wouldn't tell it to everybody. It just depends on the situation. Me personally, I would say your mind, your mind is your heart, as my overseer would say. Your mind is your heart. And it's like this, whoever can control their mind can control any situation that they're in. So if you can control your mind, you can control the situation that you're in.
And I would say that get you a doctor, a psychiatrist, whoever is prescribing your medication. Make sure that you trust them. Get you somebody that you can talk to. God gave us doctors and mental health professionals for a reason. So yes, we want to pray. Yes, we want to read our scripture. Yes, we trust God, but we're also going to trust the resources that God gave us as well. So if you are on medication, before you just drop that medication, please talk to your providers first. But very good answers, Miss Sheena. Good job. Anybody else have anything for Miss Sheena? And I do want to say, guys, that you are more than welcome to drop questions on the live. We want to hear your questions. We want to answer, provide you with an answer so that you will have an answer moving forward after this live. And we will dive into those questions after we hear from Ms. Lauren. So we've talked about medication with Ayana. We've talked about self-talking children with Miss Brittany, and our faith during mental health struggles with Miss Sheena. And so, Lauren, I would like to know from a clinical perspective, how do we begin to change unhealthy thought patterns and build a healthy relationship with our mind?
All right, so Maya, clinically speaking, I believe when I received my question, I asked myself the question maybe about 15 times, and each time I saw a different component within the same question. And so I think that I actually diagnosed my question, and it has a full F code at this point. But if I can actually break down my question to give my best response, I think that would be the best way for me. But before I do that, I just want to kind of throw out that as a clinician, in practice, I maintain my ethical guidelines. But in this conversation, I'm just going to be Lauren, and so she's very practical. So I mean no harm if I say something that's a little off the wall, but my question didn't have a targeted population, so I try not to be population biased. Okay, with that being said, how do we begin? So when I first looked at the word begin, so most persons, to begin anything, that means they've considered something, they've put a thought into it, and most of the time, before we even start to act on that, we receive some type of hesitation. And so Simply beginning something just has to have motivation, but yet we are also hesitant. So we call that a dialectical experience. And that's just saying that we're having two of the opposite of motions at the same time. So how do we navigate through that? Well, we'll talk about that on our next show. To change something, when I think about changing, I automatically think of like the substance use and the addiction population. And one of the questions that we always ask our individuals is, what is your motivation of change? And 9 times out of 10, they don't have a response. I want to stop smoking marijuana, but I want to stop doing these drugs, but most of the time they say, I want to stop going to the casino, but. So either way it goes, we're taught right and wrong at young ages. And as we're also taught right and wrong, we're also taught consequences at those same ages. And so the scripture kind of tells us that when I was a child, I did as a child, I thought as a child, but when I became a man, I put away those childish things. And so when we hear that particular scripture, then we hear the word but, and that kind of just gives us the idea of knowing that we are capable of transforming. We're capable of growing and developing and maturing in a different way. And so allow yourself to grow up. Allow yourself to no longer walk in those children's shoes and to be the adult or be that next version of yourself that you need to be. So unhealthy thought patterns, well, everyone is capable of having unhealthy thoughts. We're human. Even on our best days, everyone is capable of this. But we're not all capable of turning those unhealthy thoughts off. And you kind of alluded to like the racing thoughts. And so what happens when we dwell on a thought? That means we're ruminating on it. And that is an underlying process for depression, anxiety, PTSD, substance use. And it just traps your mind. So allow yourself to be free. And then when we look at building a healthy relationship, I know, I'm almost done, but when we're looking at building a healthy relationship, there's a song, it's not a gospel song, but there's a song that kind of says something like, when I'm in love, I step out of my world and I go into your world and our worlds become one. Y'all know what I'm talking about? No? Okay. Well, either way it go, in that song, sometimes you have to realize that I'm not in the same place as my counterpart. I'm not in the same place as you. You may not be in the same place as me. And so relationships have to work on getting healthy in order to be the best version for itself. Otherwise, it's going to be failed. I think of children, and they have traumatized relationships. A lot of times we drop a kid off over at a family member's house, and it's that same family member that might sit right there and take that child's innocence. But yet, that child no longer knows how to have a healthy relationship because the person they were supposed to trust, they've now just violated their entire lifestyle. So what do you do with that? So with that last part, wrapping this up, with our mind is ours. It's ours, and you have choices on what you do with your mind. Theoretically speaking, in everyday life, you have a choice. You have a choice to do bad. You have a choice to do good. You have a choice to love, to hate. You can make the choices. And so just make the best choice that you need to get to where you want to be.
I love it, y'all. I'm snapping my fingers. And just to toot my own horn, that's my best friend, y'all. So
Hey.
we love to see it. You gave us a whole lot, and that's my fault because I gave you a loaded question all at one time. Yes. I'm sorry. But my first question is, you said we have to grow up. Most of the time we think about growing up, we thinking about 18, 19, 20, get your life together. Can you be 50 and be struggling in your mind?
Absolutely. You can be grown, you can be married with children and still struggle with adolescent-like things because you have not matured in that way to be who you need to be for that spouse, who you need to be for your own kids. She just mentioned on how, kids have learned behaviors from what they see their parents do. They grow up and they just still have this attitude, and it's all they know. So, yes, you can be 50, but you can also be 50 and learn how to be a different version. You can reframe those thoughts that you're having, and what you're probably experiencing isn't probably even that bad. Yes, we know they hurt your feelings. Okay, forgiveness exists. Move on.
Okay, I have a question for Lauren. I guess you and Maya could answer this, but we talked about the medications, and just piggybacking off of your answer just now about growing up. So what advice would you give to people who are reluctant about therapy?
You would be surprised how many people are resistant and reluctant to when it comes down to therapy. A lot of times our parents or our older generations, they have said that you don't need that. What goes on in this house stays in this house. And that's the first sign of trauma right there, because now you don't know how to express yourself to someone out here in the community. A lot of times I can come up to you and say, hey, how you doing? Your immediate response might be, I'm good, and you? But really? Really? You know, and so when it comes down to that, I would definitely say, find that person. You know, you don't have to go in there and receive the cognitive behavior therapy. How does this make you feel? You know, let's explore this. Let's process that. Sometimes you just really need to have talk therapy when you go up in there and you tell the person, listen, life is doing this, life is lifing, and I don't get it. And you just need that person to be real back with you to say, all right, this is what we need to do, or this is what I would recommend. As far as the medications, you'll be surprised on that part too. A lot of people don't want to take medications because they feel zombified. It makes them eat too much, and they don't want to lose that beautiful figure they have, whatever the case may be. But if it's going to help you, try it. It doesn't hurt to try. We tried everything else and it failed. So why not try this? Yeah, it might be a little chemically imbalanced for a little while. Give it 2 weeks.
That's exactly what I was going to say. Do not try it for one day and say, this ain't working for me. Give it some time. Give it 30 days, guys, and let's see how we doing. Give yourself 4 therapy sessions to see if you're making any progress before you say, I don't want to talk to that lady. She don't know nothing about me. She's sitting there with her cute clothes on and her little Gucci bag sitting beside her chair. She don't know nothing about the struggle.
Hide y'all's bag.
And that's a good point, because with a lot of the medications, as Lauren said, it takes about 1 to 2 weeks to see any effect, but it can take up to 4 to 6 weeks to see like a maximal effect. So with like blood pressure, people are more like, I don't want to keep taking this if I don't see the effects of it. And so that's something else to encourage people on when taking depression meds, anxiety meds. Like it can take a while to start working.
But I also feel like people need to know that Rome wasn't built in a day. So Rome isn't going to come down in that same day. And it took you a while to realize that, hey, I'm eating wrong, so my diabetes are wrong. You had to make a modification. You had to do work on top of taking this insulin shot or taking this pill. So why not do the extra work for when it's going to impact you in your mind?
Good dialogue, y'all. So to answer Ayana's question for me, I grew up in a household, and I hope my daddy looking, because that man of God would say, you ain't got no bills. You don't have to worry about nothing. So what you stressing about? What you got to worry about? Why are you crying? What you got to be depressed for? And I had to find out for myself. I didn't start counseling until I was well in my adult years. But looking back, I definitely had stuff to be depressed over. And it doesn't mean that I was being abused in my home. It could have simply been that I had a bad day and I didn't clean up and my parents came home and yelled at me. Trauma doesn't have to be something extreme for you to be traumatized by something. So if you're noticing changes in your children, if they are seeming more sad or disengaged with you, talk to them. If they're not giving you answers, take them to somebody else who they may feel more comfortable getting answers from, because it's hard being a child. We may think that our children don't see what we're going through, but they definitely do. Even if they don't hear what's going on, they see what's going on. They can see the changes in your moods. And they feel it. And I promise y'all, they come into the school to tell us about it. Have they told you about what's going on in their homes, Miss Brittany?
Yes, they have.
Yeah, so have them talk to somebody, and you can start with the teacher. I promise you, if you message your child's teacher and say, hey, my child seems to be depressed, I need some help, what you gonna do, Miss Brittany?
Well, honestly, honestly, in my classroom, I make the space for my kids to come and talk to me. I check in with them all the time. I ask them, even if it's mid-instruction, I'm looking at you, I'm saying, are you okay? What's going on? A lot of the times they don't like to speak, but you have to build that trust with them. And it's a everyday thing, just building that relationship with them. Ask them, hey, you're okay. You know, is there anything you need to talk about? But you have to make this space, and you have to build the confidence and the security with them in order for them to share.
And are you judging your parents when you reach out to them and let them know that their child may need some help?
No, I don't judge, because everybody goes through something. And who am I to judge? You know, I'm here to help. So no, I do not judge.
So please reach out, guys. I know for my children, it takes time. It's going to take different resources. You're going to have to try different therapies or different doctors. Everything is not going to work, and it's not going to be an overnight process, as we have already discussed, especially in children. I feel like I opened up a whole lot quicker than my children did in therapy, but I am thankful that we have stuck with the process, because it takes a village, and my children's therapists are part of my village.
I also think that family counseling is important. You know, we think that it's important to get marital counseling before the wedding, but what happens after you've had kids that don't come with a rule book at all? And so a lot of times we really need to process, how do I speak to these children? How do I tell them that they need to go and do chores, which is a life skill, but yet this is what I need you to do right now, without throwing your shoes across the room and hitting them upside the head. Like, I think that family counseling is very much important, especially for our community, and it teaches social skills.
And I think therapy also, or family therapy in a sense, it teaches us, you know, like you said, things about being a parent. Like, I suck at cleaning, guys, I really do. So how in the world am I gonna teach my children how to clean? Is something I suck at. And I'm also super sensitive, so going to family therapy, it teaches me how to communicate with my children, you know, like she said, and it teaches them how to communicate with me, and making sure that we hear each other and that we're not just talking to each other, because once you talk at your children, they're going to shut down. And we need our children talking to us. I promise you, there's so much going on in their lives that we need them to feel comfortable talking to us. So we cannot just yell at them and cuss at them. And we definitely can't do it before they leave in the house or get on the bus. I promise you, we can't. We have to reel it back in, prepare ourselves for the conversation, know what we're going to say, and make sure we are emotionally stable enough to have those conversations, even if it takes us a day or two to address something.
Patience plays an important part in that. You have to have patience to talk to your kids and understand their point of view when they are talking to you.
Because they do have a point of
They
view,
do
and
have a
it
point.
does
They do.
matter.
Yes.
Yes.
And you have to give them the space to have a voice. You know, we've grown up to say kids are seen and not heard, but we can see that that caused trauma, and it also caused generational curses. So you have to let the kid have a voice to a certain extent, but just allow them to speak. Give them the space to do that. Don't just brush it off and say, hey, you know, you don't get to say anything. You don't have an input in this situation, because they do.
And I love how she said sorry to a certain extent, because the more you have those conversations, they're going to learn the boundaries for the conversation, how they speak to you, how they speak to adults. But the most important part is that they're getting it out.
But I also think that it's important that we don't adult talk our children. You know, let them be a child, and you learn how to downsize your words so that they can understand, versus you speaking in such an intellectual way that they're looking at you and you like, you got it? And no.
Yes, I agree. But I thank you, ladies, for answering my questions. Now we're going to take questions from the live, if we have any. No questions yet? Yeah. Okay, Lauren, I'll let you take that one with some different kinds of therapy.
So, treatment looks different depending on where you are. Danville specifically, we offer a lot of community-based treatment, and community-based treatment can really look like group work. Right now, we're in the process of transitioning how that looks, and that's a little bit above my pay grade. But what that did look like was adults would go into what we call mental health skill building, and they could receive like a worker, and that worker is supposed to help them with the goals that they want to achieve in life. For the children, they went into what they call therapeutic day treatment, and so a lot of times that was either after school or in the school. And that took a lot of the pressure off of the guidance counselors, because then you had a person coming into the school directly sitting with the child or pulling that child out of that chaotic classroom and just talking with the child to be able to get them to do their work. For the older population, and not even always the older population, but they also have like group services called psychosocial rehabilitation. That's another group-based program, and so that one takes you out into the community, because a lot of times we're so sheltered and isolated, we don't even know how to shop at Walmart. You would be surprised. And so we have group-based, and then we have individual-based. Individual, you can go in, like I said, have talk therapy, have somebody take you outside and just take you for a walk. Support, that is what you're building. You're building someone's support system, and a lot of times the mental health professional is the number one person on that person's support list. So I hope that answers the question, but if not, I can keep going.
I want to add, though, there's a such thing called equine therapy, and I just want to share with y'all because I found out about that, did not know. And it's where you have therapy with a horse. Like, you learn how to take care of the horse, and for my child, it helped her to become more comfortable with the therapist and to communicate more, and to also have that responsibility of caring for something else other than herself.
Was it in Danville?
It was close.
Okay. Come on, spiritual lady.
I would say don't give up on them. Continue to enforce it. Just continue to let them know that, hey, just give them, just keep supporting them, but don't give up on them because they don't want the help. Because long as you stay in their life and keep giving them positive things, then they will eventually change. If they see how supportive, how people are really looking for support, looking to see how important they are to other people before they go and get help. I guess that'll be the answer.
And I also would say that we can't help someone unless they want the help. So even though you as a family member know that they need help, unless they agree to it, we cannot help them. And I also want to encourage whoever this is, if you are experiencing this, make sure you take care of yourself too, because it can be exhausting to be overly caring for somebody and to be trying to fight those battles for them and they're not giving you any help. So please create those boundaries to keep yourself healthy as well.
And a lot of times it's just providing them with the resource. It's just saying, here, read this, or just giving them the personal experience. A lot of times we're so resistant because I've never tried this before, so I'm scared what is going to happen to me. And so if I go and I ask Maya, hey, what was your experience like? Then if she says, oh, this was like this, it's a little bit more encouraging and a little bit more push forward to actually say, I can try this or I can do this. Or if it worked for her, it might just work for me.
Yes, it is okay to apologize to your child, because there are times when you are wrong and you have to admit it, and you have to have some self-awareness and say, yes, I'm wrong. So that is okay. And it also teaches your child that, yes, we make mistakes because we are human. There's no such thing as a perfect human. So yes, apologize to your child. It is okay. It's not that you are taking the power from yourself as a parent or putting the child above you. You just need to apologize. It's okay. We all make mistakes, and it's okay.
I think it's big for a person to apologize to a child.
It shows the maturity level.
Yeah.
It shows them that if you apologize to them, then they will have, that's something that you instilled in them, so they'll know how to do it as well.
And I think it also teaches them how to navigate in healthy relationships. If I know at a young age that it's okay to take accountability, they may not know what that is, but take accountability and apologize as I get older and I start to have other relationships, whether it be friendships or whatever the case may be, I already have that trained in my mind that, okay, it's okay to take accountability, it's okay to apologize.
And also, if they are in a relationship with someone or have friends that are not apologizing, they already know, like, okay, this is not safe for me. Let me back up, because they because they are not going to provide that safe space that I'm used to. Okay, the question is, can you enlighten us on the different kind of medications available for children, as when the older people were growing up, there was only Ritalin available. So Ayana, can you just enlighten parents on what else is out there?
Yes, so are we specifically talking about mental health in general, or, because Ritalin is for ADHD, so are we in general? We can keep it in general. So there are a lot of different medications out there for a lot of the mental health classifications or diagnoses. They do overlap. So a common medication that a lot of people talk about is Lexapro, which is a part of a certain class of medications. We have our SSRIs, which are serotonin selective reuptake inhibitors. It's a lot, so
Come
I
on,
won't go
education.
into that. And then our SNRIs for anxiety. Sometimes we go with our benzodiazepines, which are controlled substances. So it's a lot of different medications. With ADHD, we have controlled substances, and we also have other things like atomoxetine or Strattera, which is not necessarily a controlled substance. So again, kind of reverting back to Maya's question, just kind of talking to your primary care provider to see which medication would best suit you as a person or your child, and taking that route.
Can we talk about that? Okay, so I feel like when you go to the doctor, be honest with the doctor. You know, like, don't just say, I had a headache one time and it lasted for 5 minutes. No, tell the doctor, I heard some voices. The voices told me X, Y, and Z. I saw something crawling up the wall. It wasn't there. Nobody else heard it. I started hallucinating. I was delusional. Be honest. Because
And can we also get into, it's okay to say if you had a suicide ideation?
be honest. Well, hold on. We'll go back to that one because, okay, so be honest in that, because you don't want to sit here and be prescribed the wrong medication. That's going to be a mess. Now, let's go on to your part. A lot of times, that's one of the side effects. You know, suicidal thoughts. That's a side effect of a lot of the medications. And so if you're having those thoughts, tell your psychiatrist or whoever is prescribing the medications for you that, hey, I took the medicine, the side effects weren't good, the symptoms subsided, and we're going to have to work through that.
So does that mean the medication is not for them because they had a suicidal thought when they started taking it?
Not necessarily.
Okay.
And a lot of those medications, again, within those first couple of weeks, that is the most common side effect, especially in individuals who are between the 18 and 24 range. Hey, you might experience suicide ideation. So just be sure to be aware of that. It does not necessarily mean you should stop taking the medication, but just something to be aware of. So moving forward, you can talk to your primary care provider and your psychiatrist and see how to navigate that.
And when they're having those thoughts, is there anyone available to support them through that?
Always. Like you said before we got started, 988 is always available. It's 24/7. You can text it, you can call it, and someone is going to be on that other side who is ready to listen and ready to say, it's okay. Do you have a plan? What is your level of intent? Now, if we start to go into the heavy stuff, listen, I have a plan. I'm on 10 out of 10. We have support for that too. We can go to the crisis center right here on Piney Forest Road. We can go down. Now, don't just go to the emergency room because that's going to be a whole process. But we have help. And if not, talk to your pastor.
Amen. I love it. So if I'm on the phone with 988 and I tell them that I'm having a thought, I've been having these thoughts, but I don't have a plan, I don't think I'm going to kill myself, but I just want to talk to somebody, are they going to call the police to come knock on my door and take me to the hospital?
It depends. It depends. It depends on your conversation. Now, I cannot say how the conversation may end, but if you get on the phone and you go off the deep end and you're kind of sounding as if the person on the other side should be concerned, of course I will come and knock on your door, because you're not going to have me on the other side and be like, well, Maya said she was fine, so next call, no. Hello?
Next question. Can we discuss mental health with our men of color? Most men have never been taught to correctly love or to love themselves. How do we discuss mental health without them seeing it as a stab
Can we hold this
to
for
their
our next?
manhood?
Can we hold this for our next panel? But we're gonna get
Sure.
into it real light. But I think that would be a good conversation
Okay,
for
we'll
another
talk about
panel.
that.
But let's get into it. Does anybody wanna answer the question? So no, but what I
You can
will
hold it.
say is that, man, you are loved. Okay, we support you. We want you to be healthy and whole, especially our black men. You are amazing. You are great. We cannot do this thing without you. And so please get the support that you need. But stay tuned, because we will have some men up here talking about their mental health real soon.
I think that's it for the night, question-wise.
I have a question. How do we go about finding therapists or people that we can talk to about our mental health problems for the listeners?
Okay, well, how do you go about doing it? Research. You know, researching. There's websites and there are listings of your practitioners or your providers who specialize in whatever that is that they specialize in. Look them up, research them, and see, hey, is this person a good fit? Go to your local CSB, Danville, Pennsylvania Community Services. If you aren't eligible for receiving services there, ask them for a resource list. They can provide you for resources from Danville all the way up to Lynchburg, all the way down to Greensboro. And hey, we're in the era now where we can go on betterhelp.com and you can find and match the person who matches well with you. Haven't tried that yet, but you know.
And I promise we're not offended. If you know what you want, if you know that you want a black male therapist, a black woman therapist, an older white lady, if you call and say, hey, do you have a therapist that fits this? We're going to tell you yes or no. And if we don't, I promise you I wouldn't have no problem letting you know where to find one if I know where you can.
We got 2 more questions, and then that's it.
Okay. So the question is, what if I need a counselor and I can only do it at home because I'm a stay-at-home mom and my kid's going crazy, or we can't afford it? What we got for?
So, like I said, the CSB, they look at insurance. They look at insurance, or they look at income in general. And so, if you have the insurance, you're good to go. If you don't, that's okay. You can go on a sliding scale fee, and most providers, they offer a sliding scale. And 9 times out of 10, it's nothing but $5 a month. Pretty good, huh? But at the same time, if you only have availability to be telehealth, then that kind of sounds like you're going to have to set some boundaries between yourself and your kids to have alone time so that you can work on yourself.
And I was going to say, because that was a question that I had too with the people that may not have the funds to do therapy or whatever. But find you a group, find you life coach, spiritual coaches, somebody that can give you tools to help if you can't, go to the therapist.
Now, life coaches cost just as much as therapy these days. That's private pay.
And the last question was, when will you be doing this again?
Soon, guys. As soon as I can get me some guys that will agree to come up here and be vulnerable and talk about their mental health, that's when we're going to have our next one. So if you are a man on this panel, please reach out to me if you're interested in joining the next one. If not, watch your inboxes because I'll probably be inboxing you. But thank you, ladies, and thank you guys for joining us tonight.